we think it's really important to begin to talk about expanding Medicare rather than simply defending it. The mantra for the past 10 years has been that we can't afford generous, effective, accessible social programs. This will go down in the history of Canada as the biggest lies of all the lies that governments tell us. A key fact to keep in mind, we are now over twice as wealthy per capita as we were in 1967 when we first brought in Medicare. We are twice as wealthy per capita as we were in 1967. And the notion that we cannot afford Medicare or Medicare is not sustainable is preposterous.
The first point I want to talk about is the fact that the push for more private insurance in Canada is leading us down an American and not a European road. It's an Americanization of our healthcare system and a corporatization of our healthcare. You know, Canadians got healthcare because of their experience with private health insurance. It's not as if we don't have experience in this country with the private health insurance market. In the good old days, before we were forced to shoulder the burden of equity, Canadians really did confront the realities in the private market, not just for insurance, but also in terms of providers, because providers also were private. And that experience is not a happy one, as anybody who lived during those times will tell you, and there's been a lot written about it as well. Before Medicare, there was just a little bit more than half of Canadians were covered by private health insurance. Most of that was through their employers. For everybody else, for the approximately 47% of Canadians who were not covered by private insurance, they did not choose not to be covered. They simply could not afford the premiums for private insurance, or they weren't working. And prior to the 1950s, most people who had private insurance, most working people, were only able to buy private insurance for themselves and not for their families. So that's why we continue, even now, in our sort of collective memory, we know that there are a lot of stories in Canada of people who were forced to sell their homes and all of their assets in order to obtain health care. And in fact, health care was a leading cause of personal bankruptcy in Canada before Medicare. Most people don't know that, but that is the fact. And that really is the true history of Medicare. Today, if we want to, we can look south of the border to really understand the great gift that previous generations have bequeathed to us. That generation fought over many, many, many decades to get the kind of healthcare system that we have. We look to the United States to get an idea of the catastrophe that we were able to avoid, and the catastrophe that might be down the road if we follow the prescription that's being handed down by people who are in favor of private health insurance and increased private provision. In the United States, almost 50 million people have no health insurance at all, and of those who do have insurance, they're confronting ever higher co-pays, deductibles, and premiums. The only reason that we don't have these same problems that are occurring in the United States is because of our public health care system. But the private insurance market in Canada looks a lot like the US insurance market. And when I say that, what I mean is that there's lots of different reasons for that, and I should say that one of the reasons is because of the integration of our insurance market with the United States under the North American Free Trade Agreement. It's one of the sectors that has the insurance, health insurance and private insurance market has, for all intents and purposes, integrated with the United States. So the same rules and conditions that are confronting Americans in the private insurance market we don't get the full punch of that because of our public health care system. But the further we go down that road, the more that we will be seeing, excuse me, these conditions prevail in Canada.
The mantra for the past 10 years has been that we can't afford generous, effective, accessible social programs. This will go down in the history of Canada as the biggest lies of all the lies that governments tell us. A key fact to keep in mind, we are now over twice as wealthy per capita as we were in 1967 when we first brought in Medicare. We are twice as wealthy per capita as we were in 1967. And the notion that we cannot afford Medicare or Medicare is not sustainable is preposterous.
The second point is that private health insurance is actually serving a shrinking portion of working Canadians, and that those who count themselves amongst the lucky ones amongst working people are finding that they are not all served equally well by private health insurance. So here's how it looks in Canada now between 1995 and 2001. In 1995, 63.3% of all workers were covered by benefits. In 2001, just 6 years later, that had fallen to 51.8%. So it fell from 63.3 to 51.8 just in the 6 years. But this really reflects the way the private insurance market functions in Canada. It functions on a discriminatory basis. The people who are the least likely to be covered work in the private sector. The people who are the most likely to be covered are public sector workers. The people who are younger and older are the least likely to be covered. If you are a young person working in Canada today, if you work in the retail sector, you are so unlikely to be covered by a public or a private insurance benefit plan. You're unlikely to be covered by anything, actually, even a good wage. But the level of coverage for people who work in the retail sector is very, very low.
Our governments have systematically raided the bank accounts for social programs by cutting taxes and cutting revenues to ensure that they don't have the money that we need for the things we want. Paul Martin cynically used the large deficits in the mid-1990s to cut $23 billion from social transfers for Medicare education and social assistance. What's really interesting about this, if you ever get a chance to look at the speech he made in the budget in 1995, he did not boast about getting rid of the deficit. He boasted about taking government spending back to the level of 1950 in terms of the percentage we spend of the wealth we have on government. He boasted about it, and he boasted about it in meeting after meeting after that budget. But the fact was that he wouldn't have had to cut it all. By 1997, 2 years after he made that budget speech, we actually started having surpluses. And Jim Stanford, an economist with the CAW, calculated that if we had not made a single cut, if we had just stayed at the level of spending of 1995, the deficit would have disappeared 1 year later. So we wouldn't have had to cut any of that $23 billion. So what Paul Martin actually had was not a deficit crisis, he had a surplus crisis. Because Paul Martin did not want to spend money on social programs and the things that people want. He wanted smaller government. He was proud of the fact he'd taken it back to 1950 spending, and he wanted to keep it that way, and that's why he gave a $100 billion tax cut over 5 years. By the way, it was the most unfair tax cut in Canadian history. 77% of that tax cut, in terms of the personal tax cut, went to the wealthiest 8% of Canadians. Corporate taxes were also slashed over the years from, I think, from about 29% to 21% under Paul Martin, and they're going down further. I think they're now something like 19%. But between 1984, when the tax cuts really began under Mulroney, and the year 2001, the federal governments have voluntarily given up $250 billion. That's $15 billion a year, less than we would have if none of those tax cuts. We would have had $15 billion more to spend, which means in terms of Medicare, which is what we're talking about tonight, I think it probably would have funded a pharmacare program and a home care program, or at least gone a very long way to doing that. Gordon Campbell's the same. came to power. He had a $1 billion surplus from the previous government. The first thing he did, the very first act of the Campbell government, was to cut $2 billion in taxes. So that creates a useful crisis. In other words, well, all of a sudden we have a deficit. In fact, a year later, he had a deficit of $4.5 billion, one of the largest in BC history, which gave him the excuse, of course, to cut all kinds of programs. So this pattern, I mean, you could go through almost every province and see the same pattern. So what we are witnessing is a sort of rapid Americanization of Canada by stealth, as public goods, that is to say those we create and use ourselves as a community, erode or disappear, and private goods and services increase where we have to spend our own money. And the difference, of course, between public goods and services and private is that public goods and services are universally accessible to everyone regardless of income, and private services are available to those who can pay. It's quite simple.
The third point is that the rights of insurers and employers actually trump our rights, our charter rights to health care. Private insurance, the private insurance market is very discriminatory, and it discriminates against it would discriminate against many of the people in this room. People who need health care are fine. If we had to depend entirely on the private insurance market, we would be no better off than the Americans. In fact, I would argue that we would be a lot less better off than the United States is. If you or your child has a pre-existing condition, you can forget about obtaining private insurance benefits. If you have a chronic condition like diabetes or asthma, if you have heart disease, if you had cancer, you are unlikely to be offered an insurance coverage. If your mother had cancer, if your mother had breast cancer, you will be denied coverage for that condition if you go to buy a private insurance policy on your own outside of the workplace. The Canadian Human Rights Act allows the private insurance industry to discriminate on three, or what they don't call it discrimination, they call it distinctions. They can make distinctions amongst Canadians on the basis of your age, your sex, or your health condition. This is entrenched in the Human Rights Act of Canada, and what an insurer has to do simply is to show that the actuarial risk is too high for the insurer to, and by the way, this also applies to employers. If you work for an employer who says, because you have diabetes, you're forcing my insurance premiums to go through the roof, and so I'm going to eliminate you from the group benefit plan. This is a right that employers have. It's entrenched in the Human Rights Act, and there is no charter challenge to the Human Rights Act, at least that I know about. The actuarial principles that are the basis for allowable discrimination read like this. This is an interpretation from the Justice Department. Among the actuarial principles that may be used in respect of age is that benefits are more costly to provide to older than to younger employees, and that gives them the right to discriminate against older workers. But we have to understand that if we the more that we rely on the private insurance market, the more we will confront these kinds of discriminatory actions which are entrenched in the Human Rights Act.
We need a counter-revolution of higher expectations. That's what we need. We can afford what we need and want from government. It's time to quit just defending Medicare, but not just Medicare, other social programs. We have to demand more.
You know, Murray talked about the need to change the language that we use, and I really second that. I think that that's very, very important. Healthcare is not really about personal rights in Canada. It never has been. It's always been about a collective entitlement. And this is the language that we need to resurrect when we're talking about healthcare. And this is why when Canadians were fighting for health care system that provided equity. It was a social justice issue. It was a social justice issue now, and it's a social, or then, and it is as well now, today. The private market does not uphold equity or equality, and as I said, it in fact discriminates, and that is not the basis of equality. People who are arguing for private health care argue is that the public health care system is unsustainable, and what they're really saying is that equity and equality in health care is no longer sustainable in Canada, and I think that we have to counter the argument by saying that we have to increase the assets in what Martin Luther King called the Bank of Justice. We have to increase the assets, that in fact it is the discriminatory practices in the private insurance market that are not sustainable. Thanks.
We need to shift our attention and shift how we fight for Medicare. We are a fabulously wealthy country. We have a strong sense of community and are committed to equality. We have the wealth to do it in a democracy. We get to decide. Thank you.